Okay, so today we are looking at one of the topics under intestinal worms. So in our previous lesson, we looked at hookworms, and with hookworms, we spoke about them being roundworms, firstly, and we also say that these worms do not only affect the GIT, in that we know that that is where they predominantly stay and cause the illness. But we also say that in their migration, they also travel to the lungs, they penetrate the skin, go through the blood, enter the GIT, then they go to the lungs, and then they come back. So that is the basis of, or the understanding that we obtained from hookworms. So in today's lesson, we're looking at another type of roundworms. And this type is called Ascariasis. The condition is called Ascariasis. Ascariasis. So firstly, we'll start by defining, because yesterday we spoke about, in the previous lesson, we spoke about hookworms and roundworms briefly. And the previous lesson, we also looked at roundworms. So today we are looking at Ascariasis. So this one is caused by a roundworm. Okay, so let's define our condition for the day. So what is Ascariasis? So we can define Ascariasis as, this is a human disease that affects the gastrointestinal tract. This is a human disease which affects the gastrointestinal tract, caused by a parasitic roundworm, called Ascaris Lubricoides. Caused by a parasitic roundworm called Ascarias Lubricoides. Okay, and then characterized by, I would put up the spelling on the board, but it is characterized by abdominal pain and presence of worms or adult worms and eggs in a stool. So we're saying it's caused by Ascarias Lubricoides. So the definition that we've mentioned here, or that we've spoken, is one that is full and complete. So we are saying this is a human disease that affects the gastrointestinal tract, and it is caused by a parasitic roundworm called Ascarias Lubricoides. You can pronounce it as Lubricoides. Okay? And then it is characterized. Remember, the definitions for medicine needs to have characteristics, at least 3. So the 3 we've said, there is abdominal pain. We've also said there will be presence of eggs and worms in a stool, or you can say passage of worms. So I'm sure we've seen children, or you yourself when you were a child, but you can't remember. You passed worms at some point. What that is Ascarias Lubricoides, that worm. And the condition was called the Ascariasis. Are we together? Okay. So now that we are together, we can move on. So that is the definition. So you find that with these conditions, we can say they are mostly common in areas that experience warm climates, hot and wet. So you find that that is why they are very common in areas such as the southern part of Africa, or basically Africa as a whole, because these areas are warm. You also find that it is also common in rural areas, developing countries, third world countries. So when we talk about third world countries or developing countries, we're talking about countries such as Zambia. Basically, we are saying countries that do not have enough resources. So you find that in these areas, they can be in Africa or outside Africa, they cannot afford to have the proper facilities for sanitation. For example, today in Zambia, if you go to a public bathroom or toilet, most of you would say it is one of the messy places that should be. It is one of the places that is not cleaned to that level. But if you go to certain countries, you go to Japan, you go to England, public toilets are just as clean as the ones that we have at home. Why? Because they have the necessary facilities. But because us as Zambians, us as Africans, and because we have limited resources, it is very hard to have sanitation throughout. So even if you look at this geographical distribution, it is mostly common in developing countries. It is common in rural areas. And most likely it is common in children. Why is it common in children? Because children like picking things on the ground and putting in their mouth. And those things can be contaminated. Are we together? Okay. So we've already mentioned that this condition is mostly common in children, or when we say children, we usually talk about 1 year to somewhere 12. That is mainly the age that we're looking at. But you find that in this condition, we can say the early ages, that is somewhere 1 year to 5 years, and then the early school age, meaning 5 to 10. So basically, we are saying this condition is common in children between maybe 6 months, 1 year, up to somewhere 12 years. But it rarely occurs in adults. It can rarely occur in you because you're an adult, but because of you, some of you, who would want to be eating soil, who would want to pick up whatever you pick up and put in your mouth. That is why we are saying it rare or it almost. If it was not because of you, it would have been 100%. But because of the soil, because of all these practices that we put up, you find that in adults, it can also occur, but it's predominantly found in children. Okay, any questions? Okay, so let's move on. Let's look at the predisposing factors. Predisposing factors. Number one, poor personal and environmental hygiene. Poor personal and environmental hygiene. So you find that people, or first let's talk about as a person. When you talk about poor personal hygiene, we're simply talking about you as a person. In the previous lessons, while we've spoken about worms or diarrheal diseases, we've mentioned to say personal hygiene is very important. Hand wash. You are from visiting the toilet, you need to wash hands. Before eating any food, you need to wash your hands. So that is why personal hygiene is very essential. So when a person is not performing the proper personal hygiene, you find that that predisposes them to Ascariasis. Okay? The second one we said environmental hygiene. So when we talk about environmental hygiene, we're simply talking about the sanitation in our environment. So what do we mean by that? We mean things such as our toilets being kept clean. We also mean things such as disposal of waste. Today, if you move around our roads, our tarmacs, you find that by the side of the road, they've made a garbage dump site. There on the dump site, you find diapers all over. Is that good environmental hygiene? No. So because of those things, they can predispose us to getting such a condition or obtaining such worms. Number two, so here we are talking about basically sanitation. Number two, poverty. Number two, poverty. When we talk about poverty, basically we mean someone failing to meet their basic needs. We understand that part of our basic needs are good water, food. When I say good water, I mean safe water, food, and these essentials such as bathing soap, such as clean clothes, such as other things that we have to use for our personal hygiene and for us to be healthy. But you find that in poverty, in an area where people are poor, you find that we cannot afford to have the essentials for our hygiene. So imagine people do not have soap to wash their hands. Because remember, hand washing is not only about washing hands with a bare soap, with water just. We also said we have to use soap. So in poverty, you find that people will lack the necessary or the essentials for them to maintain hygiene. And you also find that because of poverty, we cannot afford certain things. Therefore, we will be in a situation where we can only afford little. For example, we go through the streets. Most of you would prefer to say, me, I would rather be eating Hungry Lion, shawarma, every day. But because of our current situation, you settle for cassava. But that cassava, it doesn't mean that you want it. Regardless of whether it is healthy or not, it is about what we can afford. So you find that because of poverty, we are also driven to buy foods that may not be clean. We go on the street, we see someone selling fritters, we can buy. Why? Because I only have a 1/4. And that's the only 1/4 that I have to eat something. And that would predispose us to such conditions. Number three, the third one is poor health services. Poor health services. So when we talk about poor health services, we're simply talking about us as communities not offering enough of these health services to our communities, as health facilities to the communities. Today, at least we can all attest to the fact that in major towns or cities across Zambia, we have a program that is called the Child Health Week. And during this Child Health Week, there is also deworming. There's also all these sorts of things offered to children, services being offered to children. But we also have to understand that this is not taking place to everyone or in every community. So this simply means that in those communities where children are not exposed to deworming drugs, it is very difficult for them to treat or not to acquire this condition. So for example, we mentioned that a child needs to at least deworm twice a year, meaning every 6 months. So that means that at the beginning of the year and mid-year, this child needs to deworm. But because of poor health services, because these mebendazole and albendazole of today's world may not be acquired easily from the facilities, these people will not have the privilege to deworm. So that is on poor health services. Number 4, hot and wet environments or countries. Hot and wet environments. So here we mentioned to say an environment that is hot and wet is a predisposing factor in the sense that these environments will facilitate or accommodate the growth of these worms. One of the reasons why these European countries may not have these conditions is because the weather is cold and these worms may not survive. But in our areas, you find that because of the warm environment, because of the wet environment, these worms have a favorable environment to develop. And that is a predisposing factor. Number 5. Number 5, use of night soil. Do we know what night soil is? What is night soil? What is night soil? We can raise our hands and answer. What is night soil? You said you know. You said no. So no and no. Oh, they sound the same. So night soil is basically human waste. In agriculture, farmers, you get human waste and use it for fertilizer. So that is basically night soil. So raw human manure or human waste for fertilizer, you find that that also predisposes to this condition. And then the other one, we have use of sewage. Use of sewage. So you find that basically on use of sewage, or we can also mention it in the sense of improper disposal of waste. This is where you find that people are disposing of waste in the environment, and this can predispose to these worms entering the soil and therefore predisposing to this condition. So basically, when we talk about the predisposing factors, we can put quite a number. But here the essence is that the soil is the one that is being contaminated. So anything that is causing contamination of the soil will predispose. Things such as open defecation, someone defecating in the environment, in an open area or in the river, all these things can predispose to this condition. Mode of transmission. Mode of transmission. Let us look at the mode of transmission. How is this infection, or how are these worms transferred from one person to another or from one form into the person? How does a person acquire these worms? Can I see hands? How can these worms be transferred from the soil to the human being? How can they be transferred? Yes, Dave. So the root is the fecal oral root. When we say fecal oral root, we mean the fecal matter contaminates certain things that finds its way through the mouth. So this can be the soil, this can be the water, this can be the food. So that is the mode of transmission. Any questions? Well, okay. Okay. So let's look at the life cycle. So for the life cycle, we are going to see it, but let us try and explain what it is all about. So with the life cycle, you find that these are worms. And we said worms, the primary host for worms is or are the intestines of the human host. That is the primary place where they are found. So the first thing that we have to understand on the life cycle is that the adult worms live in the lumen of the small intestines. The adult worms live in the lumen of the small intestines, and they approximately produce about 200,000 worms per day, eggs per day. These female worms approximately produce about 200,000 worms per day. Just imagine 200,000. Those are a lot of worms being produced in a day. And these eggs will be released in the feces. So once this person defecates, they are going to release all these 200,000 eggs. So we said number one, the worms live in the lumen of the small intestines. Number two, the female worms, the female adult worms produce approximately 20,000 or 200,000 rather eggs per day, and these eggs are passed through urine, through feces. So remember, these eggs have moved from the intestines and they are now in the fecal matter, out of the body. So while in the outside body, remember these eggs have been released, so they are unfertilized eggs. So the eggs that are in the fecal matter at this point are unfertilized. So unfertilized eggs may be ingested, but they are not infective. So while these eggs are being, or these eggs are in the fecal matter, if they are ingested by someone, they may not cause infection. Why will they not cause infection? It is simply because at this point, these eggs are not yet fertilized. Is it clear? Okay. Then the other thing is the fertilized eggs embryonate and become effective after 18 days. These eggs that are fertile, remember we said the eggs that have been produced and that have been released in the fecal matter, they are fertilized eggs and unfertilized eggs. We are saying these unfertilized eggs, when ingested, may not cause infection. Then we go to the fertilized eggs. These fertilized eggs, we are saying, they will embryonate and become infective, meaning they can cause infection after 18 days to several weeks, depending on the environmental conditions. So at this point, we are saying that the fertilized eggs will start to develop. Remember, an egg develops, it turns into an embryo. So while in an embryo, it is developing, and once a person ingests these eggs, they will become effective. Are we together? So we have reached a point where these eggs have matured, they have embryonated, and they've become infective. So at this point, someone swallows those eggs. So you can swallow those eggs through contaminated water, it can be through contaminated food, it can be through contaminated soil that you have ingested. All those are ways through which someone has swallowed those eggs. So in this condition, one swallows eggs. They are not swallowing a larva. They are doing what? Swallowing an egg that is embryonated and developed. So after an infective egg or eggs are swallowed, the larva hatches. After the infective eggs are swallowed, the egg hatches and produces or releases a larva. So these eggs, once they reach in the intestines, they will hatch and release the larva. So this larva will invade the intestinal mucosa. This larva will invade the intestinal mucosa. Remember, the eggs reach the intestines. There in the intestines, they are going to hatch. Once they hatch, they will release a larva. Once the larva is released, this larva will invade the intestinal mucosa. Invade, we mean enter through the intestinal mucosa. There in the intestinal mucosa, hope. There in the intestinal mucosa, this larva will travel through the systemic, it will travel through the blood or the systemic circulation or the lymphatic system and travel to the lungs. The larva will enter, will invade the intestinal mucosa. There in the intestinal mucosa, it will travel through the blood or the lymphatic system and reach the lungs. In the lungs. So the larva at this point is in the lungs. The larva matures further in the lungs for about 10 to 14 days. There in the lungs, this larva will start maturing for about 10 to 14 days. It will penetrate the alveoli walls and ascend through the bronchial tree to the throat and will be swallowed. So we mentioned to say this larva will go to the lungs, it will start to develop, to grow. There in the lungs for 10 to 14 days, it will grow. Once it has grown, it will invade the alveoli walls and it will start ascending, to start climbing up. It will go through the bronchial tree to reach the throat and it will be coughed out or swallowed. Others will be coughed out, others will be swallowed. So once they are swallowed, they will now travel into the esophagus. From the esophagus, they will travel until they reach the small intestines. In the small intestines, these worms will now develop into adult worms. And this will take about 2 to 3 months from the time the eggs have been ingested. And finally, these worms will now mature, will get bigger, attach to the intestinal mucosa, and they will live in the intestines where they will grow, and the female eggs will start producing eggs. And therefore, you find that there will be signs and symptoms for both the respiratory system and signs and symptoms for the digestive system. Why do we have both sets of signs and symptoms? It is because these worms or this larva has first traveled to the lungs. It will cause respiratory signs and symptoms. When it goes into the small intestines, it will cause digestive signs and symptoms. Yes, so that is about the life cycle. That is basically it about the life cycle. Clinical manifestations. Clinical manifestations. So remember, we mentioned to say the signs and symptoms of the clinical manifestations can be classified into two. And the two are, number one, the ones that affect the respiratory system, which can be called the pulmonary phase, and the other one that can affect the digestive system, which is basically affecting the gastrointestinal tract. So in the pulmonary phase, we have the following signs and symptoms. Signs and symptoms in the respiratory system. Why do we have signs and symptoms in the respiratory system? It is because the larva is traveling to the lungs, and they will develop into worms, and these worms will travel through the bronchial tree. So all those things can cause signs and symptoms. So the first one is cough with blood-stained sputum. Cough with blood-stained sputum. Why will there be cough with blood-stained sputum? It is because this larva has invaded the lungs and it is migrating through. So because it is migrating through, it will cause irritation. So the reason why we are having cough with blood-stained sputum, it is because of the invasion of the larva that is migrating through the bronchial tree. Number two, pneumonitis. Number two, we have pneumonitis. Pneumonitis. So when we talk about pneumonitis, we're simply talking about basically the inflammation of the lungs, the tissue. Why would there be inflammation? It is simply because of the irritation that is caused by the movement of the worm or the larva through the lungs. That is where the inflammation will come from. So because of that movement, it will result in irritation, and that will cause inflammation. Number three, irregular respirations. Irregular respirations. So when we talk about these irregular respirations, we are simply talking about this person not being able to breathe in a regular rhythm. We understand that breaths or respirations should be rhythmatic, meaning there should be a rhythm to it. But because of these worms present in the lungs, they will cause this person's breathing to be affected. Why? Because these worms are foreign and they are developing in someone's lungs. So because of that, they will result into irregular respirations. Number four. Number four, we have spasms when coughing. Spasms when coughing. So spasms basically more like squeezes. Okay? So there will be spasms when coughing, and these spasms are as a result of the presence of the worms in the respiratory system or in the throat, because they are worms that are migrating through the airway. And because of that, there will be spasms. Are we clear on those signs and symptoms that affect the respiratory system? Tika, are we clear? Intestinal phase, meaning the GIT. So what are some of the signs and symptoms that can be in this condition when when these worms reach the intestines? So let's look at those. Number one, gastrointestinal discomfort. Gastrointestinal discomfort. Gastrointestinal discomfort due to the presence of the worms in the intestines. So gastrointestinal discomfort due to the presence of the worms in the intestines. And remember, these signs and symptoms they may ask you to say state. When we say state, you cannot just say gastrointestinal discomfort. It is a half mark. So when you are stating, you put the reason or the cause. So you are going to say gastrointestinal discomfort due to the presence of the worms in the intestines. Number two, we have abdominal colic. Abdominal colic. This is basically abdominal pain. Why do we have abdominal pain in this condition? Anyone? Why do we have abdominal pain? Yes, happy. Yes, basically it is due to the presence of worms in the intestines and them lodging to the mucosa. So that is why we have abdominal pain. There's also nausea and vomiting. So again, with this vomiting, it is basically due to the gastrointestinal disturbance as a result of the presence of worms in the intestines. So because we have these worms in the intestines, it can result in vomiting. Number 4, thing of worms. Passing of worms. These worms are going to be passed through, it can be through fecal matter, or they can be just passed as worms, but it is through the rectum. So this child or this patient will be passing worms, and that is a sign symptom. We also have diarrhea. We also have diarrhea that may be experienced as a result of the irritation of the intestinal mucosa due to the presence of the worms. So basically, those are the signs and symptoms. Okay. Any questions? Lastly, we can now look at the investigations before we look at the drugs. Per video. Bad man. Diagnosis, investigations. Don't play with my time. Investigations. So let's just quickly look at the investigations, then we can end here. Investigations. So we are going to use about 5 investigations. What is the first investigation that we can pick up? History taking. So history taking or history will review passage of worms in stool or vomitus. This patient will tell you, or this child's guardians will tell you that this child passes stool and there will be presence of worms in the stool, or when they vomit, there will be presence of worms in the vomitus. Number 2, physical examination. Physical examination. So on physical examination, you find that the patient will present with abdominal discomfort. The patient may present with abdominal colic or abdominal pain as those signs and symptoms. Laboratory tests. Let's look at the laboratory tests under the diagnosis. Laboratory tests. So for the laboratory tests, we have blood count, full blood count, which may show peripheral eosinophilia. Peripheral eosinophilia. And basically, this is an increase or an elevated amount of eosinophils in the blood. If you remember your microbiology, you learned that white blood cells are in types, or they are types. And they are what we call eosinophils. And these are the antibodies that react to allergens and other things. So there will be an elevated amount of these eosinophils in the body. The other laboratory investigation that we can talk about is a stool sample. So let's start with a stool sample. A stool sample. So a stool sample, or you can say stool for microscopy, which will show eggs, which will contain eggs. So the stool will contain eggs. Remember we said the female worm produces about 200,000 worms per day. So the fecal matter will contain eggs. Okay? So those are some of the laboratory investigations, but we can also put one more, which is gastric or respiratory secretions. Gastric or respiratory secretions. So mainly when we talk about these respiratory secretions, we mostly refer to sputum or a throat swab in children. So here you are going to see presence of the larva in gastric or respiratory secretions. In the respiratory system, because these worms are migrating, this larva is migrating to the lungs, you find that there can be presence of this larva in the sputum. So those are the laboratory investigations. And then the last one, we can get the radiology investigation. And this one is abdominal X-ray. Abdominal X-ray. This abdominal X-ray will sometimes show the presence of the worms in the intestines. This abdominal X-ray will show the presence of worms in the small intestine. So we'll end here. Any questions? Ask.